Good afternoon, everyone, and welcome to today's webinar, Empathy Across Ages, Strengthening Our Campus Community. This webinar is being hosted by the University of Calgary Centre on Aging as part of UFlourish. UFlourish is the university's annual mental health and well-being series that features a range of seminars, workshops, and events for students, faculty, staff, and the wider community. My name is Chantal Zimmer, and I'm the manager of the Centre on Aging. I will be the moderator for today's webinar. I'm joining this webinar from Calgary, Alberta. I would like to take this opportunity to acknowledge that the University of Calgary is located in the heart of Southern Alberta and pays tribute to the traditional territories of the peoples of Treaty 7, which includes the Blackfoot Confederacy comprising the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Goodstoney First Nations. The City of Calgary is also home to Métis Nation of Alberta, Districts 5 and 6. The Centre on Aging is thrilled to host this webinar that explores our ideas about different age groups and describes intergenerational empathy. The Centre is a dynamic hub bringing together people from various fields and sectors to collaborate on innovative solutions for aging-related challenges. It leads and supports research and educational initiatives aimed at addressing health inequities, improving continuing care facilities, creating age-friendly environments, and influencing policies that benefit older adults. By facilitating connections across fields and sectors and encouraging new approaches, the Centre is committed to optimizing the health and well-being of older adults and shaping a brighter future for aging communities. The Centre is embedded within the O'Brien Institute for Public Health in the Cummings School of Medicine. Under the leadership of the Centre on Aging, the University of Calgary joined the Age-Friendly University Global Network. This network focuses on creating inclusive policies, programs, services, and environments in higher education for people of all ages. Discrimination against older adults is a major issue in post-secondary education because many institutions were originally designed to serve younger students and employees. Conversely, younger adults also face challenges in having their voices heard in decision-making processes, despite being the primary student demographic. An age-friendly university fosters intergenerational solidarity by creating opportunities for students, faculty, and staff of all ages to connect and collaborate. Through educational programs, research projects, and workplace experiences, the university ensures that everyone, regardless of age, feels valued, respected, and included within the campus community. Today's webinar will consist of a keynote presentation, panel discussion, and question and answer period with the audience. The presenter and panelists will answer your questions once all presentations have been completed. As this is a Zoom webinar, all participant cameras and microphones are turned off. If you have questions for the presenter or panelists, please send us your questions using the Q&A box. The Q&A icon can be found at the bottom of your Zoom screen. If you experience any technical difficulties during the webinar, please message Lindsay Morrison or Erin Davis using the chat. The chat icon can be found at the bottom of your Zoom screen as well. The keynote presentation and panel discussion will be recorded for future viewing. The recording will be made available on the Centre on Aging's website. Today, we're delighted to have with us Kenna Kelly-Turner to speak about intergenerational empathy. Kenna is the Manager of Faculty Development within the Cummings School of Medicine at the University of Calgary and lead for the Health Professions Education Leadership stream of the Precision Health Graduate Program. She has held a variety of roles since starting at the university in 2013 and recently came to us from the Faculty of Graduate Studies. Kenna develops and facilitates educational programming on a wide range of topics with particular interests in social justice, adult learning, health professions education, processes and practices in higher education, and transdisciplinarity. Additionally, she's working on her Doctor of Education degree, hoping to reduce harm in higher education. Kenna, I'll pass it over to you to share your presentation.
Thank you so much. So this is Empathy Across Ages, and I am Kenna Kelly-Turner. So this session is going to talk a little bit about bias and stereotypes. And so whenever we do a session like this, I like to give people a heads up that there might be some triggering topics. What I recommend is if you are feeling some discomfort with what we talk about because it challenges beliefs that you have held or it puts into question things that you believe to be true, that's something where I would lean into that discomfort because that discomfort is where bridges are built. It's where a lot of the good learning happens. In contrast, if you are experiencing discomfort because some of what we're talking about is triggering to you, it's reminding you of harmful experiences that you've had, then I would say absolutely lean out. And I'm going to use this little pylon symbol here on any of the slides where some of what we talk about might be harmful for you. And so you can see that, and that's a heads up to you that you might want to step away from your computer. Today, we're going to talk about ideas about differences across ages. We're going to learn to describe intergenerational empathy, and we're going to select some strategies to increase our own intergenerational empathy. With that, I will get right into it. So in the interest of full disclosure, I am a millennial. And so one of the things that that means for me is that most of the time I think of myself as young until I encounter someone who is significantly younger than me. And this is a story about one such experience. So one day, a couple of years ago, I opened social media, which I use frequently. And I found out from social media that as a millennial, I am inherently chuggy. And that was a word that I was unfamiliar with. And I feel like I know a lot of words. So I had to look it up. And what I learned is that chuggy means someone or something that's outdated or trying too hard, usually in a very millennial kind of way. So, what things are chuggy, you ask? Well, many things are chuggy, but the first three that I discovered were skinny jeans. Okay, fair enough. Fashion changes over time. That happens with every generation of folks. I guess I can let that go. The laughing, crying emoji. All right. Cultural icons can become cliches. I guess that makes sense. I still use that emoji, but I can let it go. But then I learned that lasagna was chuggy. What? So now I felt like a line had been crossed. What has lasagna ever done to hurt anyone? Unless you're lactose free or gluten free or a vegan. But overall, that irked me. And I thought, where did these young people get the audacity? And that irritation lingered in the back of my mind for ages. Then, more than a year later, I was listening to a CBC interview with Adam Alexic, a linguistics educator who goes by the etymology nerd online, and he unravels complexities at the intersection of language and social media. And do you know what he found? That Gen Z, that's the generation after millennials, born between 1997 and 2012, they really didn't use the word chuggy. It appeared in 2 or 3 lone TikTok videos, but then it was taken up by the mainstream media, like the New York Times ran an article about being chuggy. And it was embraced by millennials on social media who used it self-referentially in jest. So all of the ire that I had built up was based on a false foundation. But as we know, the more provocative the idea, the more clicks and engagement it garners for media outlets. And that's done with little regard for how sowing division across ages negatively impacts our communities. So obviously, chuggy is a fairly low stakes example of creating misguided narratives across ages. But let's then examine some nearer and dearer concepts that we have about age. So I pose to you the question, what do we know about people across ages? The first activity I want you to participate in is a little bit of a brainstorming. So I'm going to invite you to take a piece of paper and a pen or open a Word document on your computer, or open the Notes app on your phone, however you're accessing this in whatever way. I'm not your mother. If you want to write on your hand, you go right ahead. But what we're going to do is a little bit of brainstorming about some words. And I'm going to give you a word, and then I want you to write down all the words that you associate with it. And I'm going to give you about 30 seconds on each word. And this is the word that we're going to start with, young. So you've got 30 seconds, go. All the words you can think of associated with young. Okay, 30 seconds of silence always feels like a really long time when you're on this end of it. The next word, you're going to have 30 seconds again, and you're going to do the exact same thing. But this time, the word is old. So 30 seconds, all the words that you can think of to associate with the word old. Okay, thank you for bearing with me through all of that silence. It is much appreciated. Now, the next thing that I want us to do with the list that we came up with is we're going to think about which of the words that we came up with have negative connotations and which have positive connotations. And with any of the words that you think have negative connotations, you're going to put a little star. And any of the words that have positive connotations, you're going to put a little dot. And if you find ones that you think are neutral, that's fine. You don't need to count them at all. So you're just going to go through stars for negative, dots for positive. And then when you've completed that, I'm going to ask you to count them up and think about how many negative connotations you had associated with the word young and how many negative connotations you had associated with the word old. And you can take your time, you can go ahead and count that. What I'm going to suggest to you in this not at all scientific experiment is that there is a possibility that this could be a positive reflection for you, that this is an opportunity for you to think about those negative associations, because those may be an example of ageism. Now, whether that's ageism that you hold yourself or ageism that you've observed in society, we don't know that. I can't tell you that. But it's a really good exercise to start thinking about where we see ageism. And I believe Dr. Holroyd Leduc is going to talk about ageism in more detail and get into the health impacts as well. But for the time being, let's just remember that ageism is a form of prejudice and it is experienced by both older and younger adults. Ageism can be impacted by social norms around age-based discrimination, as well as by structural conditions that affect older and younger people. So with that in mind, what are some socially normalized beliefs about age, right? I'm sure that we have a ton of them. I'm only going to talk to you for half an hour, so we're not going to get into all of them today. But let's look at one. This is one that I hear commonly. Nobody wants to work anymore. It's a common exclamation made by people of all ages, but it is primarily directed at younger folks. So with that in mind, let's think about how accurate this phrase, nobody wants to work anymore, is. How much does it capture society? Well, one political scientist researcher named Paul Ferry, who some of you may have seen on the social media app formerly known as Twitter, looked into this. And he looked into this by looking at newspaper clippings over the ages. And this is what Paul Ferry found. So people in the newspaper were talking about the idea that nobody wants to work anymore for decades. In fact, people were talking about the idea that nobody wants to work anymore for more than a century. So this notion that we have that nobody wants to work anymore is something that people have been observing for generation after generation, and it may not be as accurate as we believe it to be. And in fact, in a meta-analysis of 105 studies on generational difference in work ethic, they found that there was no effect of generational cohort on work ethic. So basically, our idea that younger people just don't have the same work ethic is unfounded in the literature. Okay, so that was just one belief that we were calling into question, right? What other beliefs are there, and are they accurate? So here's another one that I hear around my workplace at the University of Calgary. So this is a common exclamation. It's made by people of all ages, but it's directed at older adults in the workplace. It's especially common in the university environment because some people feel like the institution would have more publications or more grants if more senior faculty would just retire. Okay, so let's look at how accurate that belief is. So in an analysis of more than 200,000 publications, researchers found the conventional narrative of high productivity in early career researchers with gradual decline over time was only true for 1/5 of the faculty members studied. And in the remaining 4/5 of faculty, they exhibited a rich diversity of productivity patterns. Some people had lulls and then they had rises. Some people had sort of steady productivity over the years. So we may be wrong about age and productivity in faculty members. But what about across the broader working world? Well, researchers have looked at this, and in a systematic literature review of 74 papers examining productivity in older versus younger workers, they found no difference in productivity overall. So where does that leave us? Where it leaves us is that it appears that some of the socially normalized beliefs about age are not supported by the research literature. So now let's think about what the impacts of those socially normalized beliefs might be. And here's the part where I'm going to rely on you again, okay? So I'm going to ask you to take that piece of paper or that notepad or that Word document, wherever you were doing your first activity. We're going to open it up again, and I'm going to ask you to reflect. And I'm going to ask you to think about a time that someone stereotyped you. For any reason, it doesn't have to be related to age. And I'm just going to ask you how it made you feel. And you're not going to have to share this with anyone. This is just for you. But I want you to take about 30 seconds again. And I just want you to write down some things about how you felt. Maybe it's how you felt physically, how you felt emotionally, how you felt mentally in response to being stereotyped. And you've got 30 seconds. Okay, now I'm going to ask you another question. And again, you can just write down some thoughts that you have on it. What do you think the consequences of age-related stereotypes in our community might be? What impacts do you think those have on our community in general? And it might be a community you know well, somewhere that you work, somewhere that you study, somewhere that you play, or you might be thinking about the community more broadly. But I'm going to give you 30 seconds just to write down some of your immediate reactions to that. Okay, thank you. Again, I know the silence can feel heavy. And I'm sure some of you are thinking, why did you ask me to come here for 90 minutes so you could spend time not talking to me? There is reason behind my madness. So when we are thinking about stereotypes and thinking about experiences that have harmed us and are likely to harm others, that's an important step in mitigating our own bias. And making these kinds of acts of reflection a habit helps us interrupt our biases so that we are less likely to act on them. So it's a really good habit to get into because it starts us on the road of questioning our own thoughts and interfering with bias that is socially normalized. So with that in mind, recognizing that we found that there's an abundance of age bias that's not supported by the literature, I'm going to ask you, what do we really know about people across ages? So here are some things that we really know. And there are some researchers out there who think about the idea of truth and ontology and what is real and what is truth. We're going to call into question this entire slide, and that is more than welcome. But I want to think about the truth about demographics for a minute. And this was an idea that was introduced to me by Scott Radford, who's a marketing professor at the Haskell School of Business. And when he teaches introductory marketing, one of the things that he talks to his students about is how we use demographics for the purpose of marketing. And the example that he gives his students is he asks them to call into their mind an idea of someone. And the idea that he asks them to call into their mind is an American who has been born between 1946 and 1950. This person is white, they are rich, they're a New Yorker, and their education is from a prestigious university. So that's supposed to get a really clear picture into our minds. And then what Dr. Radford would do is bring out two pictures. And one of those pictures would be of Hillary Clinton, and one of those pictures would be of Donald Trump. And the idea is that we rely heavily on these demographics to tell us who a person is, what they believe, what matters to them, how they spend their time, how they treat their families. And yet we know from that example that these demographics are flawed. And that doesn't mean that no demographics can tell us anything by any means, but it does call into question how heavily we rely on demographics to tell us about a person. And it reveals that it might only tell us a tiny slice or a tiny portion of something about a person. And so that's what I would invite everyone here today to remember, is that we cannot rely fully on demographics to get an idea of who someone is. So primarily, the issue with our generational assumptions is that they're a form of bias that leads us to generalize about a whole group of people without strong evidence and in such a way that damages community relations. So there are obviously many changes that human beings have gone through as a result of societal evolution, with cultural and political perspectives that ebb and flow over time. There's increasing knowledge in the world that people are being exposed to with new points of view and new approaches to the way that they function. So, for example, your grandson may not set out to irk you, but may be inundated with an avalanche of new ideas that he's exploring, that he's introducing you to as well as part of his journey of developing new knowledge. Similarly, technological advancement is changing the nature of living. For example, the way we pay for parking looks a little bit different now. And sometimes we come upon a private parking lot, and the only way for us to pay is to pull out a smartphone and take a picture of the QR code and go to the web link and insert everything. And so the idea of entering change into a meter is very distant from the reality that we're living in now. And those technological advancements have made things easier for some people and more difficult for other people. And so when you come across someone who's struggling with that change, recognize that these technological advancements don't have the same benefit to everyone. And for some people, they have caused harm. And acknowledge that the world we live in, we need to find a place of balance, because humans are also living longer. And that is potentially shifting the trajectory of our development. So for example, we may find that the traditions about when you move out on your own or how long you live on your own has changed, particularly in a North American context. Or we might find that the amount of time you spend in the working world may have changed because people are living longer. And so the way the trajectory of life that we expect might look a little bit different now than it has in the past. So there is a problem with age-related stereotypes. And here are some of the problems. These are certainly not all of the problems. We tend to focus on the idea that this is about age difference. So we center age difference when we encounter someone or something that we don't understand or we don't agree with. So rather than seeing an example of a changing world with new information and a difference in life stage, which are things that we all experience, we just label it as age difference. And then we don't look any further, we don't ask any further, and we don't work ourselves to become more open-minded and to really like build a bridge across people. Another thing that we need to be aware of is that we use this lens, this singular perspective, to view all people of a certain age. So rather than taking a get to know you approach that focuses on the unique experiences and positionalities that makes a person who they are, we don't try and address their individual needs. We just focus on the fact that they are of this age and therefore they are this way. And so it interferes with us getting to know the individual. Taking this approach and relying on these stereotypes also problematizes difference. So rather than seeing difference as an opportunity to create stronger communities with different kinds of strengths and weaknesses, and instead of seeing it as an opportunity to learn from someone whose outlook and experiences may differ from our own, we see it as an issue that is going to be a headache, and then we shut down. We don't want to engage with it. We don't want to learn anything more. We don't want to try anymore. We just decide this person is of a different age. They are different than me, and therefore I'm not going to bother with this. Another thing that is important to keep in mind is that from time to time, we have an altered memory of our own past. So a few years ago, my mother moved in with me, and sometimes we will talk about the past. We will talk about my childhood, and she and I have very different recollections of things that happened or things that we said. And we're never going to be able to resolve that because we don't have a recording of what took place. And maybe that's a familiar feeling for some of you out there. But what I would invite you to consider is that from time to time, we have a sort of warm, glowy nostalgia for how we were at a certain stage of life. And that may not reflect reality at all times. So we may tell ourselves, oh, well, when I was that age, I worked 12 hours a day. Or, well, when I was that age, I had already saved up X amount of dollars and I was like ready to move into my own place and I didn't spend my money irresponsibly. And so that's something that can really interfere with building relationships across ages. Another really key point is that we grant ourselves a special permission to do things that we do not grant to others all the time. So when we remember our own mistakes or our own poor choices, we tend to excuse those decisions or explain those behaviors away. And that's a benefit that we are less likely to grant to others, especially if we see those others as different from us. So that is an opportunity that we can invite ourselves to just grant other people the benefit of the doubt that you would want granted to you, right? It sounds really simple, but these are all things we need to remind ourselves to do because it's not necessarily second nature. So what can we do? Well, the first step is letting go of our own stereotypes. So some of the ways that we can let go of those stereotypes are considering the community impacts. So we already did a little bit of this, thinking about what the potential consequences are for community when we have age bias or we rely on age stereotypes. I think that the panel will talk about some of these impacts in more detail. Another activity that I always invite people to do when they're working on their own bias is something called consider the opposite. So if I think that a person that I work with is difficult to deal with and being a problem simply because of their age, I just stop myself and I invite myself to consider the opposite, which is maybe the person is behaving this way because they had a really hard day and actually the bus didn't come on time and then it rained and they got a hole in their shoe. There's so many reasons that people could maybe be interacting with us in a way that's problematic beyond the assumption that we make that we place on age bias or any other kind of bias, right? Another thing that we can do is interact with positive counterexamples that help us question our own bias. So, for example, if you believe that older adults are shut-ins who don't leave the house, maybe participating in a social club or volunteering with an organization where older adults work and where they are highly engaged and where they are out in the community doing things will help you by countering that negative stereotype that you might have. Another thing that we can do is take on a sort of lifespan perspective. So rather than saying, oh, women of X age are not very reliable in the workplace, you can think about things like being a parent. And maybe you've had an experience of being a parent, or maybe you remember when your parent was working, and you remember that at certain times in our lives, we have certain kinds of competing obligations. And we focus on that as something that everyone has in their life in different ways at different times. And instead of attaching it to age, we just think about, oh, we all go through this sort of life trajectory where we have different competing interests at different times. Another thing that you can do is you can account for cultural change. So if you believe that something that someone has said or something that someone believes is so different than what you believe that you couldn't possibly have a conversation with them or engage with them, it's important to recognize that over time, culture shifts and it goes back and forth, and things that we believe now, we maybe didn't believe in the past, but maybe we believed them before. And so all of those things are shifting, and we as human beings are capable of shifting. And so engaging with that open mind and that perspective that all of us can shift and change and try and do new things is going to be a lot more, it's going to open a lot more doors for us. Additionally, and this is sort of the bottom line with all of this, is that the ideal is that you want to see the individual. You don't want to know someone as their age. You don't want to know someone as just their race or just their weight or just their kind of ability. You want to know someone as their whole selves, and you want to give them the opportunity to share that with you. And part of the way to invite that is to be as open and non-judgmental as possible when they're trying to share that. So how do we build intergenerational empathy? Well, we know that empathy is the ability to understand and share the feelings of another. The keys to that are replacing problematic generational assumptions with assumptions that we all want to do our best, remembering that all community members need to feel valued, and then recognizing the uniqueness of life experiences, skill sets, and perspectives. So our communities are stronger when all of us are involved in them, and when we have that variety and depth of experience and knowledge, we are better as a community. So now you might be asking, how do we practice intergenerational empathy? Well, I'm going to put that back on you, because we've shared today a lot of ideas about things that we could do, things that we can practice. And so now I'm going to ask or invite you to make one commitment. What is one thing that you will do when you leave here to build your empathy across ages? You don't have to write it down. You don't have to share it with me, but share it with yourself. And hopefully that's something that you can commit to when you leave here. So as we discussed, research doesn't support the accuracy of our age-based stereotypes. These stereotypes negatively impact our community, and we can practice intergenerational empathy to better include everyone in our community. So I hope that you've made that commitment. I'm going to hand it over.
Thank you, Kenna, for that thought-provoking presentation. Next, we're going to hear from three of our panelists. Our first panelist will be Dr. Jana Holroyd-Leduc, who's the professor in the Cummings School of Medicine at the University of Calgary, and also the academic lead of the Center on Aging. Her research interests involve the use of knowledge translation science to improve the care provided for older adults. More recently, she's been collaborating on several initiatives exploring equity, diversity, inclusion, and accessibility and the culture within medicine, as well as exploring the impact of ageism on health. Jana will be sharing her academic perspective on ageism and the importance of intergenerational connections. And then second, we'll have Dr. David Hogan, Professor Emeritus in the Cummings School of Medicine at the University of Calgary. He's a retired specialist in internal medicine and subspecialist in geriatric medicine. He joined the university in 1990, where he held the Brenda Strafford Foundation Chair in Geriatric Medicine. David will be sharing his professional intergenerational experiences as a former faculty member and current retiree. And Maruk Tanweer is an honors student in the Faculty of Kinesiology at the University of Calgary. Combining the lessons learned from her degree, her love for Pakistani culture, and her passion for physical activity, Maruk has been conducting a qualitative research study on barriers to physical activity among Pakistani older adults with the aim of formulating recommendations that promote inclusivity within the Pakistani community. Maruk will be sharing her intergenerational experiences as a student and member of the Pakistani community. So Jana, I'll turn it over to you to speak first.
Thank you, Chantel. So as Ken has outlined, ageism refers to how we think, so in terms of how we stereotype others based on age. It's also how we feel in terms of our prejudices or our emotional feelings towards others based on age. And it's how we act in terms of discriminating against others based on age. So how we treat others. Although ageism can occur towards any age group, as Ken has outlined, in North America, it's actually most prevalent towards older adults, with about 1 in 2 people being ageist against older adults. It exists at the structural level, so within our society and in our institutions, including our universities, in terms of ageist policies and practices. And it also exists at the individual level. So it's our interpersonal relationships, such as the ways we treat older adults and how we limited their autonomy or how we act paternalistic towards them. It can also be directed inwards towards oneself, resulting in individuals self-limiting their behaviors based on internal stereotypes about age. As a healthcare provider, I'm particularly concerned about how ageism is impacting health. Evidence suggests that ageism is associated with worse health outcomes related to denied access to health services and treatments, increased mental and physical illness, as well as increased risk for cognitive impairment, poor quality of life and well-being, poor social relationships, and exclusion from health research, making it challenging for practitioners to really know how to best treat illness as one ages. Ageism is also costing the healthcare system in terms of increased costs. Based on a study coming out of the United States and extrapolated to Canada, we know that age discrimination and negative age stereotypes are costing the Canadian healthcare system millions of dollars each year. However, the biggest impact on healthcare costs relates to negative self-perceptions of aging and how that translates into how individuals behave. So given all of this, addressing ageism should really be a health system priority. If we look at the evidence around what increases ageism, as much as Kenna has gotten to today, it relates to anxieties about aging, a fear of death, and negative perceptions of older adults within society. Evidence suggests, though, that there's ways to decrease ageism as well. These include making positive presentations of older persons, making needed resources available, and improving individuals' physical and mental health, which reduces their self-directed ageism. So pragmatically, what this means is that we should be developing more opportunities for intergenerational activities. This can include things like creating multi-generational outdoor exercise equipment and accessible parks and community gardens that all can enjoy across their age groups, as well as creating opportunities for students and younger individuals to learn from older adults, such as by situating daycares, schools, or even university dorms in or next to continuing care facilities. This has been done in other countries to great success and to a smaller degree across Canada. However, it has not become the standard right across our country as to date. We also need to work to increase the number of positive presentations of older adults through the media and by utilizing opportunities for older adults to be role models and mentors for younger persons, with the university being a prime setting where this could occur. We need to work to ensure existing and future health policies don't promote inequities by age. And we also should be demanding that our research funding agencies establish requirements for inclusion of older adults in medical research. We ourselves can also promote and participate in healthy behaviors that have been shown in the literature to decrease the risk of developing frailty and chronic disease as we age, such as not smoking, minimizing the alcohol we consume, participating in regular physical activities, as well as eating healthy, which includes incorporating vegetables into what we eat every day and overall trying to consume more of a plant-based diet. The Age-Friendly University Initiative that Chantal spoke of is one way to help address ageism and the related negative impacts through making needed changes within education and research, as well as by overall creating a more positive campus environment for all. Higher learning institutions should be leading the way to addressing ageism in society. Now I'm going to pass it on to Dr. David Hogan.
Thank you, Jana. And also thank you, Kenna, for your comments at the beginning. Intergenerational connections are a promising area for the cultivation of empathy through hearing from diverse perspectives, having assumptions challenged, and fostering mutual respect. Traditionally, universities have been based on intergenerational interactions, with older faculty teaching and mentoring younger students. In a center's report assessing age friendliness that Jana mentioned, and which also can be found on the center's website, 70.2% of faculty respondents were 50 years of age or older. If you look at undergraduate students, that percentage was 2.9%, being 50 years of age or greater. So you can see quite a change, a difference between the two. And also it highlights this sense of the university being at its core an intergenerational institution. And in light of the long history of intergenerational connections in the university setting, it is surprising that we aren't better at least some respects of this opportunity. Possibly this is because we don't include those older in our intergenerational connections, like people who have retired, such as myself, or including people from outside the university itself. For example, research and education is often done on or about older adults, but less often with them. And that being done with them entails thinking about developing research and performing research and teaching by including older adults in those tasks. In 2007, Mark Zuckerberg, who's now 40, said, and I'll quote, "Young people are just smarter," when referencing technical innovation. This obviously requires qualification. Andrew J. Scott at the London School of Economics has written that while knowledge of the most recent technological advances is greatest in the young, there are other important forms of knowledge that increase with age. These obviously should not be neglected and are often based on life experiences. I'm representing the University of Calgary Retirees Association, but only speaking for myself and not for the organization. I do want to tell you a bit about the association, though. It was originally founded as University of Calgary Emeritus Association in 1992 and renamed itself in 2022. Its objectives are to bring together retirees for the betterment of the membership and their families, and to foster ways that its members can contribute to the life of the university and society at large. Membership is open to all retired staff. That includes academic staff, library, support staff, and administrative, who had worked 10 years or more at the university. And that does not have to be continuous. I joined the association after retiring from the university in my practice as a physician specializing in geriatrics this April when I turned 70. I've been asked to comment on how my relationships within university have changed since becoming a retiree. I need to warn you that I'm new to this role. I initially thought it would take 6 to 12 months to make the transition, but I've been told it will more likely take longer. One colleague, for example, told me that it takes 2 to 5 years, but it does appear to take about 1.5 years as a minimum. What I can give you are my initial experiences. Like many of you, I was very work focused. In fact, my family would tell you I was a workaholic. I was admittedly ambivalent about retiring. I was pushed towards it by my feeling of being in a rut with no opportunity to move on to something new, different, and stimulating. But on the other hand, pulled back by thinking of what I would do after leaving my 51-year commitment to medical training and practice. I have nothing profound to say on why I picked 2024 to retire. Turning 70 seemed as good a time as any to take the leap. I was in reasonable health and financially secure unless I lived over 100, which I doubt will occur. I've also always been someone who wants to leave before being asked, which I think would make me an ideal house guest. I can now tell you that living retirement is different than teaching students and trainees about it. As Malcolm Cowley, an American writer, wrote, "A great deal has been written about old age, but most of the authors are in their late 50s or early 60s. They know the literature, but not the life." In the retirement sessions put on by the university that I attended, I don't recall hearing from anyone who had recently retired. Also, retiring doesn't mean leaving all parts of your work behind. I've withdrawn from medical practice and tried to divest other aspects I no longer enjoyed, but have remained involved in, for example, research projects that still serve my interests and purposes. Another early learning for me is not to expect retirement will work itself out by itself. You have to invest time in finding your retirement journey and then living it. For me, this is an ongoing process. My interest in medical history providing a bit of a bridge for me. I also recognize that I may need help in doing this, possibly by talking to someone I know and respect to clarify what is meaningful and provides purpose to me, something I've really never done, at least never done over the last 20, 30 years. I do know that I have little interest in dwelling in the past and in my focusing on my current physical and financial health. I'm interested in my personal growth. And I should also say I'm interested in intergenerational activities that I could contribute to. For younger attendees, one piece of advice I'd offer is that your thinking about being old should begin now. It's not a possibility, it's a probability. Most of us, and that would be conservatively estimated as 70% or greater, can now expect to live to be 80 or greater. You will eventually be joining this old group that I'm becoming part of as well. I think I'll stop now with my comments, and I'll be happy to participate in the Q&A session that will follow. But right now, I'm looking forward to hearing from Maruk.
Thank you so much. So thinking about intergenerational empathy, I reflect on my own journey, like many others, as a Pakistani immigrant and student researcher. I moved to Canada from Saudi Arabia when I was 12 years old, so my experience here began as a first-generation Pakistani immigrant. Here, English was not my first language. In fact, growing up, we mostly spoke Urdu at home with my parents and grandparents who also moved here. Many older adults who also immigrated to Canada do not find that English is their first language. As Urdu is the native language for Pakistanis, it is very important for me to remember this language as it is a way to stay connected to my roots, culture, and values. As I continued my education here in Canada, I learned English and gradually adapted to life in a new country. But as a Pakistani student, I became involved in community centers across Calgary, particularly working with older adults at the Genesis Center. And I was especially passionate about physical activity and the intersection with that along with language. And something I noticed early on was that most of the Pakistani older adults that I met didn't have similar opportunities. Many faced significant barriers, because they didn't speak English fluently or none at all, or due to the challenges including isolation and limited community resources for this demographic. This personal experience sparked my interest in understanding more deeply the unique challenges that Pakistani older adults face. I wanted to learn about the barriers that they experience and the potential supports that could make health and activity programs more inclusive, considering aspects like language, gender, age, and cultural values. With this in mind, I joined the Relationships and Exercise Lab as a student researcher, where I was able to pursue a project focused on interviewing Pakistani older adults in multiple languages, including Urdu and English, to better understand their lived experiences with physical activity. Being both a Pakistani student and a researcher allowed me to approach this work with a certain empathy and insight, as I could relate to some aspects of their journey while also recognizing the uniqueness of their experiences. Many of these older adults immigrated 20 to 30 years ago, but their experience as first-generation immigrants were unique, while also facing similar barriers that were often compounded by language-related barriers, limited social support, and cultural isolation. One of the most important insights I've gained from this qualitative project is just how widely the experiences of first-generation immigrants and older adults can vary. It's crucial not only to understand their unique perspectives, but also to accurately represent their voices. Reflecting on intergenerational empathy, this project has helped me recognize my role as a Pakistani researcher working to bridge gaps and foster inclusivity in health research, starting here in Calgary. This is especially meaningful for groups like Pakistani older adults. For this demographic, social settings should be safe with access to inclusive spaces where they feel comfortable speaking in the language they prefer. Many of these older adults also moved here to pursue their careers and often didn't fully realize the importance of physical activity until recommended by a doctor after experiencing an adverse health outcome. This context highlights the need for more inclusive, culturally aware health initiatives that not only support physical activity, but also address social connection and accessibility. All in all, this research highlights the distinct immigrant experiences of Pakistani older adults, much like many other immigrants who move here when English is not their first language, exploring the values that they uphold in terms of cultural norms and linguistic preferences. These factors significantly influence their participation in physical activity, which in turn affects their overall well-being and active aging. By understanding these lived experiences, I hope to inform community initiatives, including this campus strengthening a campus community initiative, and research practices that are more inclusive and supportive of these demographics, which could potentially explore research projects in multiple languages and in more culturally inclusive spaces. I'll now like to thank you guys for listening, and